Hi, Dr. Diane Cleverly here from Personal Healthcare Information. I'd like to do a highlights video today of ISPOR. ISPOR is the International Society for Pharmacoeconomics Outcomes Research. You probably haven't heard of that, ISPOR, but it's not as popular as some of the cancer meetings or the diabetes meeting or the heart meeting, but it's really important. So I'd like to hit some of the highlights, not the presentations, but the big highlights of the meeting. One of the keynote presentations was around PCORI, that's the Patient-Centered Outcome Research Institute. This institute just gathers together a lot of data, and the data is for patients, physicians, and healthcare policymakers so they can make better informed treatment decisions, how good a treatment works, how cost-effective it is, and what they can expect in the way of outcomes. The other thing that PCORI is really trying to get to the root of is, in the past, patients were more like the subjects of a research study. They were the ones that were acted upon. PCORI likes to see patients acting as partners in research studies. So there's feedback and they're engaged, so they can take a more active role in the outcomes. Another thing that was all over the ISPOR meeting was big data. You're already familiar with big data, whether you know it or not. We've always had some big data around in the form of databases of Medicaid, Medicare, and the VA hospitals, but now we have access to 30 million EMR records, that's electronic medical records. We're also just on the cusp of getting access to lots and lots of these, that's wearable tech, that's the Fitbit, or even more notable, the Apple Watches and some of those wearable techs. Once researchers get their hands on the information, stripped of course of any personal patient information, they will be able to actually see effectiveness of a particular treatment or modality or an intervention. That's really important. Research studies really don't measure how effective something is. They measure something called efficacy. Efficacy is how effective something is within a very small patient population, only the one that was studied. Effectiveness can really give us some answers about real-world data in all patient populations. An example of something they can use this big data for is to tell whether or not someone is going to be likely to come down with Alzheimer's. They can look at big data now in the databases and say, oh wow, look, people who came down with Alzheimer's a few years prior, they fractured their hip, and we noticed that they have missing skin exams. They never went for their skin exams. Using that kind of information, they can go now and see who's fracturing their hip and who's missing skin exams and get them into an early Alzheimer's intervention program. Another thing that was really neat at ISPOR is I got a peek into IBM Watson Oncology. Amy Ellenberg gave us a little presentation where she showed us the usefulness of the IBM Watson AI for helping physicians who are involved in oncology treatment of patients. The example she used was a 67-year-old female with stage 2 breast cancer. Her physician, who was overwhelmed, as all oncology physicians were, relied on Watson's AI technology. IBM Watson is loaded up with 2 million pages of text, 2,000 textbooks, 10,000 hours of training, and 200 journals. And with all of this information, when the physician inputs the EMR records, IBM Watson uses its algorithm to give a ranked order of preference of treatment as a suggestion for the physician. It's a real time saver. And as you know, the US in particular is undergoing a physician shortage. Other countries are as well. And in just a decade, we're going to be short of specialists, 45,000 doctors. So we really need to save time for these valuable specialists. And I think IBM Watson will go a long way in helping our physicians save time.
Thank you for listening, and for more information, please visit us on the web at personalhealthinfo.weebly.com.